Thank you, Cliff. Welcome, everybody, to the Intersocietal Accreditation Commission and the Society of Nuclear Medicine's joint webinar on what practices need to know to comply with CMS rules. Before we get started, I'm going to go over a few housekeeping things. First, if you're having any technical problems looking at the slides or watching the webinar, you can email webinars@intersocietal.org. That's webinars@intersocietal.org. The next housekeeping item is to let you know that technologists are eligible for 1 continuing education credit from watching and participating in this webinar. It will be a voice credit from the Society of Nuclear Medicine, but a couple of caveats. You must actually be registered under your own name in order to receive the CE credit, and you actually have to be logged into the webinar. Following the webinar, we'll submit a list of attendees to the Society of Nuclear Medicine, and you should receive an email within a couple of days from the Society of Nuclear Medicine. There will be instructions in that email, and you'll have to complete a test in order to receive the CE credit. Now, I know I've just said the word test and struck fear into all of your hearts, but never fear. Everything that is on that test is actually in our presentation today, and you can actually download these slides of the entire presentation. If you look in the upper right-hand corner of your screen, you'll see 3 little pieces of paper. You can go ahead and click on that now and download the slides, or at any time after the presentation, if you want me to send you a copy of the slides, just go ahead and email me. So with that, we're actually going to start out with a survey here, and I'd like you all to all participate. And the question is who are you? So if you could actually just click on whatever applies to you. The first choice is technologist, physician, physicist, administrator, or other. And we'll give everybody a second to say who they are. And it looks like predominantly there are technologists on this call, which is good, but a welcome to everybody. So with that, I'm actually going to turn the presentation over to Sandy Katanik, who is the Chief Executive Officer of the Intersocietal Accreditation Commission. And she's going to be explaining all about the Mipa law and the requirements for accreditation. So Sandy, please take over.
Thank you, Mary Beth, and welcome to everybody to this webinar. We are delighted that you've taken an hour out of your day to listen to us talk about something that is probably more near and dear to our hearts than it actually is to yours. So let's start with what is Mipa. Mipa actually stands for Medicare Improvements for Patients and Providers Act of 2008. And I'm hoping that most of you know that, and it is for advanced imaging only, and it will require accreditation by January 1st, 2012. And advanced imaging is defined in the Mipa law by CT, PET, nuclear medicine, or MRI. Today we are concentrating this program primarily on PET and nuclear medicine, but the Mipa law in general covers all of these types of testing. And just to give you a hint, you will see in your test that when is accreditation required by, and it's January 1st, 2012. And this is going to be a recurring theme through at least my portion. I think it's kind of interesting to note the history. On July 9th, 2008, now we're talking almost 3 years ago, the Senate actually passed the Medicare Improvements for Patients and Providers Act in the Senate, and it was previously passed by the House. Many of you may remember, we certainly remember it very well because we streamed it into our office that day. This is the last day, actually, that Senator Ted Kennedy was wheeled into the Senate chamber to cast his vote in favor of this law. But then promptly, 6 days later, the bill was vetoed by President Bush, but it was overridden by both the House and Senate, turning it into law. Almost a year later, the proposed rule outlining the requirements for accreditation organization and imaging providers was published in the Federal Register. And then on November of 2009, the final rule appeared in the Federal Register with a requirement for the accreditation organization's applications. And the interesting thing, if you note in this fourth bullet, that November 25th, 2009 is when the final rule was published by what our application had to contain, and it had to be submitted by December 1st, 2009, 6 days later. I'm happy to report we met the deadline, and on January 26th of 2010, we were officially approved as an accrediting organization in the Federal Register. So if you've never seen a Federal Register, here's Reading the Federal Register 101. This is a page from the January 6, 2010 Federal Register, again pointing out that you must be accredited by January 1st, 2012. And I've highlighted that again because many of you have, many people have a tendency to confuse the accreditation requirement by 2012 with some of the private insurers that simply say you have to have an accreditation in process or in-house with one of the accrediting organizations. This is not the case with CMS. For Medicare, you must have your certificate in hand. You must have your complete official approval by January 1st, 2012. So who are the recognized accrediting organizations? Well, again, I'm so happy to report that we were officially designated, along with the American College of Radiology and along with the Joint Commission. So let's talk again a little bit about the whole advanced imaging accreditation component. As I mentioned, it does include MRI, CT, nuclear medicine, and PET. This was actually taken right from the Federal Register that CMS is not proposing at this time to include other diagnostic imaging services. They were required to approve the accrediting organizations by January 1st, 2012. And this law applies to organizations, suppliers that furnish the technical component of advanced diagnostic imaging services, billing under the physician fee schedule. That would be Part B. It does not apply to hospitals. And just in case you missed me say by January 1st, 2012, I put it down one more time. So what were some of the factors for designation of the accrediting organizations per Mipa, and how did we meet that? The organization had to demonstrate the ability that they conducted timely reviews of all accreditation applications. We take approximately 12 weeks at the most to accomplish that, and they found that to be fine. Have an established process for the timely interpretation of new advanced diagnostic imaging services. Use random site visits, site audits, or other strategies for ensuring accredited suppliers that they maintain adherence to the criteria for accreditation. And we actually, this was something we didn't have in place for all of our IAC divisions that we implemented in last year. And so now all divisions will use either a random site visit or audit at some point in the middle of the accreditation cycle. And I think Mary Beth will talk more about that later. We also had to take into account the capacities of suppliers located in rural areas. Interestingly, we told them that we didn't have anything in place because we felt that bad care was not better than no care, and they kind of accepted that answer, so we were good to go there. And we had to establish reasonable fees to be charged to suppliers applying for accreditation. And we are a not-for-profit organization. We are financed completely on accreditation fees, and so our fees were considered reasonable to CMS. We also, as an organization, have criteria that we have to maintain and that we have to have standards for. We have to have standards for the qualifications of non-medical personnel, and I'm sure you're all familiar with the standards for the technical director, the technical staff, the physicist, the ancillary personnel. We also had to have standards for qualifications and responsibilities of physicians, and in our standards, these are the medical directors and the medical staff qualifications. We had to have performance specifications for equipment, which we do. We had to make certain that our standards ensured the safety of personnel and patients, and they do. And we also had to have standards for quality assurance and quality control that ensure the reliability, clarity, and accuracy of the images. And we certainly have always had those in place. So what I'd like to do is ask another poll question. So this kind of helps us better sort of present this in the future. And so we'd like to know which choice regarding your Mipa knowledge best describes you, especially prior to the webinar. Did you know anything about it? Wow. And this is kind of, I think, Mary Beth, where we thought it would fall. These are pretty consistent with the questions and the lectures that we've been doing. So just about 70% of you did know about it. And our most frequently asked question is, does it apply to my facility? So, so I think we'll close the poll there and hope that you've all had a chance to vote on that. So that's all I'm going to talk about Mipa today, but I think it's probably important to touch just a little bit on other factors that affect the growth of accreditation. Well, okay, one factor that affects the growth of accreditation, and I would say that's reimbursement. And so there are also Medicare policies, those would be local coverage determinations by state for a vascular and echo. And we're not going to go into that at all today, but those are all published on our websites for our individual divisions, and you certainly are encouraged to look there if you provide those services. And also private insurers. There's quite a number of private insurers, and I'm going to go through a little bit of a list there. And, of course, my biggest disclaimer here is that this list is likely incomplete. Just yesterday, we received a request from a small insurance company in Ohio that wanted to verify the accreditation status of a provider in Ohio. They're not on this list. We had no idea that they had this policy in place. And that typically is how we find out that there is such a policy, is when the insurer calls us to verify the accreditation status of a provider. So we know a lot about United Healthcare, probably Highmark as well. And I'll show you some examples of some of these. United Healthcare, this policy actually started affecting us the most in 2008. And this is an example right off of United Healthcare's website. You would go to the clinical resources site. You could go to radiology, or you could go to cardiology. They have the same pieces posted in both. And then you go to imaging accreditation. And they talk about the things that you need to know relative to their policy. The important thing is they decided not to put a hard date on this, but rather to align it with the Mipa date. But because it didn't include echocardiography, the Mipa doesn't include any ultrasound or echocardiography, they've formally notified everybody that they have a 90-day window to tell you that they can require accreditation at any time. So you are wise if you are at least in the process for accreditation. Even more wise if you're already accredited. So here's an example from Anthem Blue Cross and Blue Shield of Virginia. They published this actually back in 2009. And you can see in the box that they have recognized us and ACR. And I think what you're going to see on most of the private payer policies is that they are really only recognizing IAC and ACR because those are the two programs that are specific to image quality, imaging accreditation, and the review of actual images. So we typically see that the Joint Commission is very often left off of these policies. Many of you may be affected by CareCore National. This is a radiology benefit manager primarily in the Northeast, and they actually recognize all of the IAC programs for CT, MR, nuclear medicine, and ultrasound. This is one that is relatively new to us. It was just published last December, and it's Aetna Mid-America region. And chances are you may be affected by this if you're in the entire middle of the country. There are actually 17 states that are affected by this policy, and that is January 1st, 2012, aligned with the Mipa requirement. But please note also that echocardiography is covered in that as well, so it doesn't just cover advanced imaging. Then we have there was some confusion for a while, and while this did not affect the nuclear medicine and nuclear cardiology components, it did affect the accreditation requirements for MR and CT. National Imaging Associates is another fairly large radiology benefits manager. They contract with a lot of private insurers, and they have required accreditation as part of their privileging process pretty much for all of their imaging programs. And but for a while they had some questions as to whether or not they would recognize our ICA MRL division and our ICA CTL division, but they do, and so we're pleased to report that. So we talk about what affects the growth of accreditation. Well, let's look here. Our very first policy relative to nuclear medicine was published in 2003 by Oxford. And Oxford is actually a division of United Healthcare right now, but in 2003 they were not. And they're primarily New York and New Jersey. But I think the important thing to note here is that if you look just down here in 2002, how low the number of applications we received, I mean, it doubled in 2003. And that was really based on the Oxford policy. And of course, then when you see the massive growth of accreditation by all of our divisions, this is completely due to the United Health requirement and some private insurers. I think that's why you see the vascular component even rising there, and the Mipa requirements. So it definitely is interesting. So why do payers and why does the federal government like laboratory accreditation as a component for reimbursement? We think that it's because the accreditation organizations actually set standards for and assess an entire organization. So we look at physicians, at technologists and sonographers, at the physical facilities, at the actual instrumentation that the laboratory or facility uses. We review every protocol relative to imaging and operation of the facility. We're very heavy on quality assurance and making certain that the facility has strong quality assurance programs in place. But probably most important is that we review the actual work that a facility does. And in the case of the IAC, and again, I think Mary Beth will cover this in more detail, we review a lot of pathology, and that's very important to our program to be able to review that. So we talked about Mipa, we talked about reimbursement, and so the majority of the rest of this will be devoted to talking about mostly the ICANO process. So if you're not familiar with the IAC is actually the parent organization of 6 divisions. And we started in 1990 with Vascular. We added Echo in 96, Nuclear in 97, MR in 2000, and CT in 2007. And just this year, we actually approved our first 3 carotid stenting facilities for accreditation through ICA CSF. These are all individual divisions, but they are all managed and under the umbrella of the Intersocietal Accreditation Commission. Each one of those divisions actually has a whole set of their own sponsoring organizations, and sponsoring organizations are determined and sought from those membership organizations that are involved in that specific type of diagnostic testing. So for the nuclear medicine and nuclear cardiology accreditation, these these 7 societies are the ones that were most involved in nuclear medicine. And so we have AMI, we have ACC, we have the American College of Nuclear Medicine, the American Society of Nuclear Cardiology, ASRT, they're one of our newest members, the Society of Nuclear Medicine, and the Society of Nuclear Medicine Technologists section. And we also have a commitment from the American Association of Physicists in Medicine, and we're still awaiting to have the official representative from that organization on our board. And so we'll put this poll question up there, and then I'm going to go ahead and turn this over to Mary Beth. So we would ask that you indicate which of the following best describes you. And this is relative to the accreditation process. Are you already accredited? Are you accredited by an IAC division, by ACR? Are you working on it? If you're not accredited, I'm a little worried that 9% of you haven't started the process yet. Hopefully we can subtract you right out of the Mipa doesn't apply to me, because if you haven't started the process yet, you really, really, really need to get started. So with that, Mary Beth, I think it's up to you.
Thank you, Sandy. All right, I'm actually now going to give a pretty brief overview about the accreditation process and what you have to do to get accredited. And don't worry, we're going to have plenty of time at the end. We're going to go over some of the frequently asked questions we're getting about the Mipa right now, and then we'll open up the phone lines and let you ask questions. So the first thing I want to start to talk about is what do we accredit? And the ICANL has 3 accreditation areas. The first is nuclear cardiology. We accredit in nuclear medicine, general nuclear medicine. We accredit in PET. And then we have comprehensive accreditation, which is 2 or more of the previous list. The accreditation process itself, I'm going to give you a little bit of a timeline. The first thing that has to happen for a laboratory is they need to assess their current status and compare them to our standards and see where they stand and how much work they're going to have to do. The second step in the process is to fill out the online application. Getting ready to fill out the online application, getting all your policies and procedures up to date, takes far more time than the actual filling out the application. I've had lots of facilities telling me that it took them less than 2 hours to actually fill in the application, which is probably better than doing your taxes. Once the application is submitted and we receive the case study materials in-house, we have 4 application processors who go through each application and look to see that all of the documents are there, that we can open all of the uploaded, and that all the case study images are present. From there, the applications are sent out for peer review, and each application is sent to a physician reviewer and a technologist reviewer who, in a blinded fashion, review the application and look at the protocols, look at the quality of the case study, and look at the quality of the reports. From there, their reviews come back into the IAC office, and Tom Roy, the associate manager, and myself actually compile all the data, and then we present it to the board of directors, who makes the decision on whether to accredit your lab or not. If your lab is granted accreditation, accreditation is for 3 years. And then there's a new part to the process that in the past we had a process where your lab was either site visited or audited prior to getting your accreditation decision. Well, now with the changes as a requirement of Mipa, we're required to audit or site visit every lab at some point during that 3-year accreditation period. And I'll be talking a little bit more about that in just a moment. So the first step, as I said, is assessing your laboratory and comparing and looking at our standards. And our standards are the foundation of the accreditation process. They're created by the board of directors, and they're essentially the rules of engagement. But they define what a quality lab does and their policies and procedures. You can download our standards from every one of our web pages. It's located right in the middle, and you can download a PDF document. This is probably the most important step in the accreditation process. Read the standards so you know what we expect. The standards are divided into 3 parts. Part A is the structure and organization and all the definitions. This is where you'll find the requirements or the qualifications for staff. This is where you'll find the requirement for CME for the physicians and the technologists. Part B is all of the policies and procedures that you're required to have. You're required to have quality control procedures. You're required to have protocols for all of your imaging studies, your stress studies, and your therapy studies. And then Part C of the standards is the quality improvement. And quality improvement is a big part of the accreditation process. All labs are required to do several types of quality improvement, and we have a lot more information on our website describing the quality improvement required. So how do you actually fill out your application? Well, you can access the application from any of our web pages on the right-hand side. And when you get to your application, it's a secure application. You have to have a user ID and password. If you've lost your user ID or password, if you're already accredited, just email our office and we'll be happy to provide it to you. One of the suggestions we give laboratories is always make sure you have more than one user associated with your account, because if you lose a technologist or a staff member quits, we can't release the information and you'll have to get a whole reset of your user ID and password. So it's always nice to have several people with access to your application. In addition, you want to make you can allow lots of users, and you can have lots of people working on the application at once, and you can actually have individual staff members go in and update their own CME over the 3-year accreditation period. Now, I want to give a brief word about the numbers, and there's a lot of confusion, and we're not actually sure about the numbers right now. Earlier this year, CMS indicated that for each facility that's accredited, they would accept one national provider identifier number. And what the national provider identifier number is, it's kind of like the Social Security number. Everybody has one, and it's individual for them. And then you can also have a group one, which is a lot like a tax ID number. So every physician has a national provider identifier, and it's used with all insurance companies. CMS also indicated that they would accept one Medicare enrollment number. And the Medicare enrollment number is the number that it's an application that individual providers or groups fill out in order to be able to bill Medicare. So in addition to everybody's national provider identifier, they all have either a group or an individual Medicare enrollment number. Part of the problem right now and some of the confusion is we updated our application in February to accept one national provider identifier and one Medicare enrollment number. Medicare has now indicated that they're going to be accepting more than one national provider identifier for accredited facility. More than one Medicare enrollment number may be appropriate for your lab. So we're actually asking labs to just kind of hang tight at this moment. When we know definitively our application will be updated, and sometime late this summer or this fall, we're going to ask everybody to make sure and verify that their numbers are correct so that we transmit the right information to Medicare. So if you're wondering where you'll actually put this on the application, you'll notice that there's a question on the very first screen that says, do you bill Medicare Part B for the technical component of the advanced diagnostic imaging? You need to answer that question yes, and then you'll have the ability to enter your facility's national provider identifier number. You will only get that if you answer yes to the question above. So just make sure that we've got those numbers. And if you're not sure what your national provider identifier number is, there's actually a link right in the application where you can go straight to the CMS website and learn more. So in the application, it's a multimodality application. You can go in and apply for CT, echo, MR, nuclear, or vascular with the same account and login. And what you need to do is you actually go in and say what modalities within each of the areas that you're going to get accredited in. The application is actually a smart application, and by that I mean is you answer some questions up front, and based off the information you give in the beginning, it tailors the application to ask specifically what you need. So you go in and actually fill in your staff members. You tell us all of the locations that you're performing imaging, and you actually tell us your equipment. Based off of that information, when you get into the actual application part, it will ask you to upload the specific documentation for each physician. It will ask you to upload the quality control for your equipment. So it's a smart application. It's smart also because if you notice on the left-hand side of your screen, you'll see a menu tree. And that is all of the steps that's involved in filling out the application. As you complete each step, you'll see that you get a green check mark, and areas that still need work or there's some unanswered questions have a yellow caution sign. Also in the application, there is help. If you don't know what we're looking for or what the standard is, for instance, say you don't know who has to have BLS certification or who doesn't, you can click directly on the link in the application. It takes you out to the standards, and you can see what the requirements are. How much is it going to cost you to get accredited? Well, in the past, we actually had a $200 online access fee just to be able to open your account and work on an application. We actually got rid of that earlier this year, so you don't have to worry about that anymore. But for each of the modalities individually, nuclear cardiology, PET alone, or general nuclear medicine alone, the fee is $3,300. If you're going to do comprehensive, where you're doing two of those areas, it's $500 more, so it's $3,800. And then each additional site that you go to is an additional $750. We announced earlier this year that we're now offering a multimodality discount. So that means if your facility is getting accredited in echo and nuclear medicine, for each additional after the first one, there's a $250 discount. So if you get accredited in all of our modalities, CT, MR, nuclear, vascular, and echo, you're entitled to that $250 with each additional application that you submit. In March, we announced a new policy for mobile labs, and I want to just briefly touch on this, but encourage you, if you are a mobile facility, to contact our lab with your specific questions. In the past, we accredited mobile service companies, and we were accrediting the mobile service provider, not the actual sites that that the cameras went to. With the Mipa law, it requires that each individual site be accredited, and so our old policy didn't work with that. So in March, we did away with our old mobile policy. We no longer accredit mobile companies by themselves. We now have, it's called a multi-mobile policy, where you can apply for accreditation for each site that the mobile equipment goes to. So again, there's information on our website or call for specific questions on the mobile policy. If you want to estimate, we have an online fee calculator, and it's very simple to use. All you have to do is click on the modality that you're getting accredited in. The next step is to actually say what individual areas you're getting accredited in. So for this example, I'm going to choose nuclear medicine and PET, which would be a comprehensive application. You indicate the number of sites you have in your facility, and then from there it'll actually calculate the fee. So for the example I just gave, there was the base fee of $3,300 plus the $500 for the comprehensive for both of the areas, and then $750 for the additional site. So the subtotal is $4,550. It's very simple to use. You can get it from our website and within the online application. So specifically, what do you have to submit? What information are we looking for in the accreditation materials? Well, you're going to have to upload, as you fill out the application, the radioactive materials license, any of the staff qualification documentation, such as board certificates for the physicians, medical licenses, technologist certification, registry, and license documentation, and then BLS or ACLS documentation for physicians, technologists, depending on if the physician's supervising stress test. You also have to upload your policies and procedures. The very specific policies that you need to worry about are the patient identification, the pregnancy and breastfeeding policy, the administration of radiopharmaceuticals to patients policy, and this is a policy that often gives labs trouble. They're not sure exactly what's required to be in this policy. I recommend that you actually look at the specific requirements in our standards. Set out on our website under sample documents, there is a sample administration of radiopharmaceuticals policy that you can customize for your lab. You're required to upload your quality control protocols for your gamma cameras and PET scanners. You're required to upload the preventive maintenance documentation, the quality improvement plan and minutes, and then your clinical protocols for all of your imaging tests, your stress tests, and your pharmacologic stress tests, and your therapy protocols. You have to submit case studies, and for your case studies, there's very specific requirements that change. There's different ones for myocardial perfusion imaging and what we require for general nuclear medicine and what we require for PET. and those specifics are located on the website. But in general, you want to make sure you submit all of the images used in the interpretation of a study, because if you remember, I said that we're going to send your case studies out to a physician and technologist reviewer, and they're going to see if a reasonable physician could make the same diagnosis based off the information you present. So you want to make sure we have everything that your physicians use to interpret. We need a copy of the final reports, and if you're doing stress testing, we need to see the ECG tracings. And then finally, you have to submit your most recent quality control images for your gamma camera. So we want to see your uniformity or your floods. We want to see your resolution linearity images, which is your bar phantoms, and we want to see your most recent center of rotation. When you submit your application, you're going to upload all of your policies and procedures electronically, but you're going to send your case studies to us, and we prefer that you send us electronic images on a CD, DVD, or flash drive. And we appreciate that some labs don't have the ability to actually submit electronic data. It is perfectly acceptable to send hard copy. It's also perfectly acceptable to send in electronic and hard copy data to make sure that we can easily get to what we need. Just a word of caution, if you're going to submit a CD or a DVD with the images on, you need to make sure that the DICOM viewer is installed. We do not have all of the different viewers. We don't have cameras sitting around here that we can just pop your CD into. So our advice is make sure that any CDs or DVDs you send to us, you can actually take them home and open them up at your own home computer, and that ensures that we'll be able to see images. You're going to have to mail us the application agreement, which is basically the contract between you and us regarding accreditation, and you can download that from mycanal.org. And then finally, you have to mail in the attestations, which signed by the staff attesting to the truthfulness of the materials represented in the application. We strongly suggest that anything that you send to us, that you send it with a registered tracking, send it UPS, FedEx, so that you can track when it gets to us and that we actually got it. There are three possible application decisions that a laboratory can get. The first is that you're granted accreditation right off with, and it's valid for 3 years. The second reason is a delay in accreditation. That means that there are some issues that need to be resolved, that need to be remedied by your facility. We tell you exactly what those are, and then we tell you what additional documentation you need to submit to us. You'll get a letter from after the board of directors meets. And then once you straighten out those things, accreditation is easily granted. And then the final decision is site visits, and that's a very rare thing that happens, but occasionally there are applications that we just can't make heads or tails of, or following the board's discussion of the application, we're just not sure whether to grant or delay, and in that case we may require a site visit prior to making the accreditation decision. The main reasons that labs are delayed accreditation, first and foremost, is insufficient CME and CE by the interpreting physicians and the technologist. Each staff member is required to have 15 hours of continuing education or CME relevant to nuclear medicine every 3 years. Another reason accreditation is delayed is lack of quality improvement data and or minutes. Labs may have a plan, but they never implement their plan, or they don't have meetings. Protocol issues is another reason for delay. Most frequently, the protocols aren't site-specific or camera-specific. They just submit the manufacturer's manual, and that's not site-specific. They're not detailed, or they might be missing sections. And frequently, labs fail to include their acquisition parameters or their processing instructions. The last reason that labs are delayed accreditation is reporting issues. Myocardial perfusion and stress images are required to be integrated. No matter whether it's a myocardial perfusion study or a general nuclear medicine study, there's got to be a complete description or quantification of defects, a complete description of any positive or negative findings. And then finally, reports are just missing some of the required data elements, such as the date of report, the exact dose of the radiopharmaceutical, the route of administration, or the gender are frequently left off of reports. And then the last thing I wanted to touch on is I mentioned that there's now going to be a new process for audits and site visits. It started back in 2010, and all labs at some point during the accreditation period are either going to be audited or site visited. It's total random. I don't have any say in who gets site visited and who gets audited. The computer decides that. There's no cost to the laboratory for a site visit or audit. And you need to know that it can happen at any time during that 3-year period. Should you not submit the required audit documentation or agree to a site visit, your accreditation may be suspended or you can lose your accreditation. And then the most ugly fact about all of this is we're now required to perform site visits and they're unannounced. So you'll be notified that your facility is chosen for a site visit and you can expect us to come out within 2 to 3 months after that. For the audit, if you were ever audited by us before, you know that it was a horrible, terrible, nasty process with all of those attachments. Well, I'm happy to say that it's actually much, much simpler, the audit now. For the audit, we're going to have you update all your laboratory demographics. We're going to want to know any changes in operations, such as if you have more sites or changes in equipment. We're going to need you to confirm and update the medical and technical director. We're going to want to know any changes in personnel, if you added any physicians or added any staff. You're going to need to submit the minutes from the 2 most recent quality improvement meetings that I just discussed. We are going to look at the reports. You're going to have to submit 1 report from each interpreting physician for the areas that they interpreted in, and the reports have to have been within 30 days of when you get your audit notification, so we want recent work. And we have the option to ask for case studies, but I have a feeling that's going to be a very small percentage of labs that are audited. And then the last thing, if your lab was originally delayed accreditation and there were things that you had to fix, you're going to have to sign an attestation that everything that your lab was delayed for is now, and you're maintaining compliance with the delay deficiencies. So we have lots of resources available for you. I've spoken that we have our website, and that is our primary means of communicating with you. And there are specific sections where if you're first-time accreditation, you can click on that area and get everything you need to know as a first-timer. If you're currently accredited, there's tools out there for you to perform quality improvement. There's information on any changes in your laboratory. And then if you're seeking reaccreditation, there's a special section of the website for you. As I said, our website is our most important tool for communicating with you, and that's where you find the standards, you find reimbursement information. There's frequently asked questions. Anytime we know something, we make sure that it is up on our website to help you. Another tool that's out there is we frequently do webinars such as this one, but we also have a series of on-demand webcasts where we've taken accreditation and broken it into little individual parcels or little bites for you, so that if you want to know specifically what the staff qualifications are, you can watch a webcast just about staff qualifications or reporting or protocols. I've mentioned the sample documents multiple times. It's located over on the left-hand side. I think there are about 60-some sample documents out there, and there's a new section with a lot of quality improvement help out there, and there's a sample quality improvement plan out there. So with that, let's get into the frequently asked questions, and I'm going to turn it back to Sandy for this portion.
Thanks, Mary Beth, and I'd like to extend a special thanks to Mary Beth because she almost single-handedly updates those sample documents, and it is amazing the wealth of information that resides in that particular part on the website. So if you're ever in doubt about a policy that you want to write or that you want to edit or a QA form, I would just really strongly encourage you to go to that site. Now, I am going to wrap up with some of the most frequently asked questions we have. And so let's start with the most frequently asked question we do receive is, does Mipa require hospitals and or hospital outpatient departments to be accredited? And the answer is no. Mipa only applies to those suppliers of the technical, not the professional component that bill under the outpatient physician fee schedule. As I mentioned before, that's typically referred to as Part B. Next frequently asked question is, does Mipa require accreditation for fluoroscopy, echocardiography, and or vascular testing? And the answer to that is no. It only applies to the suppliers of the technical component of advanced imaging, which we've already talked about being nuclear, PET, MRI, and CT. But we have been told that it is possible that they could reopen this and they could expand the Mipa requirements at any time. So it definitely doesn't require it now, but stay tuned. It is our federal government at work. So Which accreditation organizations have CMS recognized? IAC, we are a multi-specialty organization. ACR is a radiology-based organization. And then we have the mysterious Joint Commission. They use their ambulatory care program. We have been unable to firsthand see their standards, and we don't have any clear evidence of their image evaluation or their specific image expertise in their program. When is the latest I can submit my application? Now, there was a surprising number of people on this call that have not yet even started their application. So we are strongly suggesting that you submit by July 1st. This will give you adequate time should you be delayed, and a large percentage of our applicants really are delayed. So you need to factor in the time that you may have to change some things, may have to provide additional documentation of compliance before you actually have that certificate in hand. And so this does not account for the time to complete the application. So we're just talking submitted a completed application. As I mentioned before, the time from submission to decision averages 12 weeks, and it doesn't account for the time to correct the delay issues. This is a really hot question we get all the time, is how will CMS be notified that my facility is accredited? We have to commit to biweekly data transmissions with CMS, and I am happy to report we have already shared some of those data transmissions successfully, so we know the process works, and it will work come January 1st. You as a provider will not be required to send them anything. It is all done electronically. However, as Mary Beth pointed out when she went over the application, the critical items that we are going to transfer that must be accurate in your application is the Medicare enrollment number, the NPI number, the supplier name and site address, the effective date of accreditation and the expiration date will be shared with them, and the specific imaging modality that you're accredited in, should it be nuclear, MR, CT. Oh, here's a hot one too. How about new labs? Does my lab have to be in business for a year to be eligible to apply? And do I have to meet the minimum volume of procedures listed in the standards before I can apply? Well, the answer to those questions are no and no. You are eligible to apply for accreditation as soon as you have performed the studies that are required to be submitted to us with the required case study pathology. So if you're a new lab, let's say you just opened in March, you should have reviewed the application already and noted, or you could have even gone onto our website and noted exactly what pathology is required so that you immediately can start acquiring the cases necessary to submit to us. And as a reminder, our standards have two important words in them, and when you see a must, that is a requirement, and when you see a should, that is a recommendation. And the volumes that are listed in the standards are listed as shoulds. They are only recommendations, they are not requirements. So if you are a low volume lab, you can apply at any time. How about new labs after 2012? Okay, get your pens ready because this is a very frequent question we get in advance, and we have been getting in advance. I want to open a new imaging center in 2012. Is there a provisional accreditation? And you might have noted in Mary Beth's decision pathways that she had the red line through provisional grant. Well, the reason that red line is through there is we used to have that, but CMS required us to do away with that decision. So there is no more provisional accreditation. And so when the law passed in 2008, there were no provision for new facilities, and as part of the deeming process, the accrediting organizations were no longer allowed to grant any type of provisional. So we suggest strongly that you contact CMS directly with your concerns over not having any process in place. and ask that they implement some form of either a provisional accreditation or a grace period for new facilities. Many of us even commented to the proposed rule in 2009 that we felt that this was an oversight. So again, consider contacting CMS and or your congressman. We've actually had people do that as well. Just a little bit ending with some housekeeping. Here is your contact person at CMS, and we are on monthly conference calls with Sandra, us, ACR, and the Joint Commission, and she has told us repeatedly, her message is always the same. Please have people with questions about the law or the rules contact me directly. She answers very quickly. She's excellent at answering your questions. So how do you find any information on the CMS website? It's on their Medicare provider supplier enrollment. And this is the website. Again, Mary Beth pointed out how to get the handouts, and so you would have this website address on your handouts. And finally, how do you contact us? There is Mary Beth's email address. Randy Meyer is our senior application specialist. Randy is a woman, so sometimes that's a little helpful to know. She likes you better if you refer to her as she. And of course, you can always email me, but just know I usually forward those to Mary Beth. I'm just kidding. But any of us can answer any of your questions, and we do have a toll-free number as well. So if you want to ask a question, you can press *1. If one of your questions was actually one of the FAQs that I just went over, you can remove your question from the queue by pressing #. And please remember that you have to be registered and you have to be logged in order to get your CE, and you will receive an email from the Society of Nuclear Medicine probably next week.
All right. So Cliff, go ahead and open up the phone lines and we'll take questions.
Sandy and Mary Beth and Cliff, it's Linda.
Once again, if you have a question, press *1 on your touchtone.
I have a question from Andrea for Mary Beth that I was going to put out there before Cliff took the phone call once.
Go ahead, Linda.
Okay. Andrea asked, for the RAM license upload, do we upload the last amendment along with the original license or just the original license?
Andrea, we want to see the whole license, and you're going to have to sometimes scan that as a big document. If your amendment has to do with new sites or new physicians, then we absolutely do need to see the amendment, because if you say that one of your physicians is an authorized user, and you've just added him an amendment, we're going to need to see that. Cliff, is there any questions in the queue?
When is it anticipated that hospitals will have to be registered or accredited?
Looking at our crystal ball, we don't really have any idea when we think they'll need to be accredited. CMS and the FDA is well aware that problems exist in all settings of imaging, not just outpatient facilities. However, the Mipa rule did only include the outpatient setting. Interestingly, if you're in California, you will be required to be accredited regardless of setting by 2013. So it may just be that we see it even come down more to the state level.
Okay.
Next question, Cliff?
Our next question comes from Paris Manmudar. You may go ahead.
This is Haris calling just to find out about the NID number with multi-specialty group. Is it the journal number you need it, or I think I asked before to somebody, or the physician who is on a license?
It depends on how you bill, Harish. If your facility's billing and each of your physicians are billing individually under their own NPI number, then you're going to want to make sure you give it a stat number. However, if it's a group and the group is actually billing under one NPI and one Medicare enrollment, the group number is fine. And our application is going to allow you to enter multiple numbers and the best combination that works for your facility.
I see. All right. That's helpful. Thanks.
You're welcome, Hirsch. Next question, Cliff?
Our next question comes from Deepa Ishiro. You may go ahead.
Yes, on the Section 8.3, I have a question. Section 8.3, 1.3, diagnostic imaging and processing area must include adequate space and proper orientation to eliminate crosstalk. We have a lab where we have a workstation, the imaging table. It's very not much, probably about 8 feet or 10 feet apart. Is that adequate?
The answer is it depends. What you're going to need to do is you may need your physicist to help you do this. You're going to need to see if you're getting doses out of your hot lab and walking in front of the camera, if you're getting shine through onto your camera. The fact that we don't have specifics as to how big the room has to be or how close your tech can sit or how close anything can be. But if you have a hot lab that's directly opposite of your camera head when it comes around in the LAO projection and you see a big flash of, not lightning, but actually somebody walking by or actually your flood sources, then it is a problem. So you're going to need to evaluate that first. And we occasionally see that, but not often.
Okay, as far as radioactive crosstalk, that's okay. We don't have any of that. But as far as the technologist sitting, talking about patients or, patient on the table will be able to hear that, is that a consideration?
That is not a consideration.
Okay.
Then you're fine there. And then in regards to your technologist sitting there, as long as they're, you're not, they're within ALARA and you're not giving them undue doses. And if you are getting above your ALARA levels, then you may need to put in a shield or something. You may need to address it.
Oh, thank you.
You're welcome. Next question, Cliff?
Our next question comes from Joey Webb. You may go ahead.
Yes, I noticed on the sample application it asked for a unique lab number. What is the unique lab number, please?
Are you meaning for our application?
Yes.
It's actually automatically assigned to you. If you go into managed users, you'll be able to see your lab's unique number. It's automatically assigned for you. When you log in, it's there. When you opened up your account, you were assigned a unique lab number, and then with each application you submit, you get a new application number.
Okay. Thank you very much.
You're welcome.
Our next question comes from Iris Bordeno. You may go ahead.
Yes. You had said we have to include our QI minutes in a re-accreditation. How do you want the whole 3 years worth or the most recent?
We ask for the 2 most recent, but I'm going to give you a tip that make sure you're required to have 2 quality improvement meetings a year. You want to make sure that your minutes document that you did administrative, technical, and interpretive quality improvement, because our reviewers are going to look at your minutes and see, okay, they did patient satisfaction in the first quarter. All right, so that's administrative. They'll look and see if you did something else like image quality, and they'll look to see that you did it. If you submit minutes that one of the areas are missing, you're going to be delayed and asked to submit some minutes that show us that you actually did all 3 areas every year, or for the last year, for the most recent year.
Okay, when we do our, the 4 QA meetings, 2 of those we do include our QI.
And that's fine. That's absolutely fine. We just want to make sure you send us a minute to show you talked about quality improvement, because that's what we're looking for. And there's actually a sample checklist that our reviewers use out on our website, again, under sample documents, that you can look and see how you're going to be evaluated. So look at your minutes yourself and make sure you could answer the questions, yes, so our reviewers can answer the questions, yes.
Thank you.
You're welcome.
Our next question comes from Nicole Winsman. You may go ahead.
Hi, Nicole.
Hi. Hey, just wanted to clarify some multiple mobile sites. We have like 30 outreach sites, and more than half, 25 of them are affiliated with the hospital, and we have about 3 that are not. They are currently on our license for being accredited at this time, but how do we proceed at this point? Because we've already, you know what I'm saying, we've already paid for those sites that aren't affiliated with us.
Okay. Are they sites or are they mobile sites? Are they multi-sites or mobile sites?
Mobile sites.
Okay. Mobile sites. The mobile sites, as long as they're the hospital and they're billing through the hospital payment system, you don't have to do anything.
Sure.
For any sites that are billing individually on their own under the physician fee schedule, as Sandy mentioned, you're going to need to call the office and speak to Randy, and Randy will show you where the forms are to convert them over to from a mobile to a multi-site.
Okay.
Pretty simple. And she'll walk you through.
We did do us as a multi-site, but my question then is, are they a separate application?
No. They can be included under one application, and later this year you'll have to update and make sure we have all the right numbers so that they'll get paid for by Medicare, the studies.
No.
Call the office just because these are a lot of specific questions, and you can call me and I'll help you there, okay?
Thanks very much.
You're welcome, Nicole.
Bye.
Yeah, bye. Next question, Cliff?
Our next question comes from Jean Wyndham. You may go ahead.
Hi. Can you delete things from the application once it's uploaded?
Depends. Your question, if you're talking about the actual application part where you answer the questions and you've uploaded one set of protocols and you've made changes, you can just re-upload and it writes over what you previously uploaded. So you don't have to actually delete it, just re-upload.
Okay. And since I have multiple accreditations with your agency, can I subtract that off of my application fee before I send it in?
If you have, and another area, Echo or Vascular, it will actually, when you get to the end, when you click the submit button, it takes you to the fee cart or the cart system. It'll automatically do it for you.
Okay.
No, Mary Beth, not quite yet.
Oh, not quite yet. I'm a liar.
Not quite yet. Well, not quite yet at that point. We recommend that you don't subtract it if it doesn't come off in the cart, Jean, because we will send you a credit for it at this time. There's just a small window of time that it's not going to be showing up in the cart until it's there.
Okay.
I'm sorry, Jean.
I have another question about the QA plan. Did you just want an outline of the plan, or did you want the actual projects that we did?
We want the actual projects. We want to know for your plan is actually going to define what you're going to do, when you're going to do it, and how you're going to do it. So, yes, if you go online, there's a sample quality improvement plan that's pretty good, shows you options of things you can do, and then there's a schedule, and it says, okay, the first quarter of 2011 we'll do administrative, and the second quarter we'll do technical, and the third we'll do. So it's when you do it is up to you, but, yeah, it's a plan. We want to know what you're going to do.
But you don't want the actual projects that I've completed already, right?
No, we want the minutes where you discussed the results and came up with ways to improve your lab based off of your quality improvement activities.
Okay, thank you.
You're welcome.
Our next question comes from Irma Oliver. You may go ahead.
I have a question. One of the ladies was asking about her QIs, and you said you do them twice a year. I thought they had changed that to 4 times a year. Am I wrong on that?
Not exactly. There is a requirement, the very last actual standard, that labs are required to have meetings, staff meetings, at least 4 times a year. Mm-hmm. And what happens during those staff meetings is totally up to you. One could be your annual radiation safety training. It could be one where you talk with the schedulers and the transcription people. Mm-hmm. You are required to have 2 quality improvement meetings per year. They can coincide. You can have them during those other 4 meetings. What we're specifically looking for and what you have to upload in the application is your actual quality improvement, the minutes that show when you talked about quality improvement.
Okay.
Okay?
All right.
Our next question comes from Deepa Nishiro. You may go ahead.
Yes, I do have a question on the center of rotation. It says must be performed to ensure mechanical and electrical alignment of the center of field of view. But is that required to have all collimators we use, or currently we only do COR on LEHR?
And that's fine. And that's fine. We're not requiring that you show us on all of them. If you're most frequent, the only one you're going to have to submit to us. At the time of site visit, we're probably going to look and see that you are doing it. If you're frequently doing gallium studies and you're doing gallium specs and you're doing it frequently, then you should be doing CORs because mechanical and electronic heads can change.
Okay.
But just all you're going to have to submit to us is your most common collimator that you're using.
Okay, so we have to have it on site.
Yes.
Okay.
Yes.
For inspection. Okay. Thank you.
You're welcome. Cliff, it looks like we have time for 2 more questions. So go ahead and we'll take the 2 last questions. And if anybody else who's not able to ask their question, please email me. I'll put my email address back up on the screen, and I'll be happy to answer your questions, or you can call me and I'll take them directly. So go ahead, Cliff, 2 more.
We have a question from Kathy Whitaker. You may go ahead.
We need some clarification on the CMEs required by the physician. And when you say staff, are you talking about technologists or just staff members that have been trained to use the equipment?
Okay. All interpreting physicians and all technologists are required to have 15 either CME for the physicians or continuing education by an improved method like the voice, like what we're giving today, every 3 years. And that's 3 years within the when you submit your application. And those CME or CE must be relevant to the performance and interpretation of a nuclear medicine study. So CME about cardiac MR would not be relevant to the performance interpretation of a nuclear medicine study, so it wouldn't be an acceptable credit. Out on our website, we have a predetermination list where there's about 70 courses that people have sent to us and asked us to evaluate them. And when we evaluate them, we just add them to this list. And you can look up some of the courses that your physicians might have attended and get an idea of what's approved and what's not. For any other staff members, such as your nurses or your stress people, they're not required to have, just technologists and interpreting physicians. Stress test supervising physicians, if they only supervise stress tests, are also not required to have the CME.
Okay. Our understanding in looking at the application is it's requiring 40.
For nuclear, nope, it's just 15 every 3 years.
We're EMT. We're just doing CTs.
Okay, Sandy, do you know the CT requirements? I'm sorry.
That's if you're coming in through that educational and training pathway, then that's where that 40 hours of CME comes in. The ongoing CME requirement for every medical and technical staff is 15. But that is specific to CT, and it's specific to that training and experience pathway. And I would be happy if you want to call that 800 number and ask to speak to me to explain that even further.
Okay.
To Mary or to Sandra?
Either Mary or me. Mary or Sandy. Yep.
Okay.
But not to be confused with Mary Beth. Mary Lally is in charge of the CT program.
Okay. So
all right. Last question, Cliff. Sorry.
I'm sorry. We need to call who?
Mary Lally.
Lally? Okay. Thank you very much.
You're welcome.
Our final question comes from Derek. You may go ahead.
We're in a hospital setting, and we have well over 20 cardiologists that interpret for us. Some of them are here every day, and some of them are here a handful of times per year. I noticed in the site visit you wanted to see a report from everybody listed, with a recent report within a month. If there was a physician who hadn't read anything for a month, would that cause us to, have a delay?
Yes, you would probably, if they're listed on the application and they are interpreting physician, we're going to need to see some work. It doesn't say that they absolutely have to do a live patient. You could certainly create a dummy patient, but we're going to want to see some documentation that they're maintaining compliance with the reporting standards. So we will require it for every physician listed on your application.
Okay.
Okay. All right, with that, we've taken our last question. I would like to, for Sandy and I both, thank everybody for being on the call. We hope you found it helpful. And again, please contact us with any questions that you might have, and keep your eyes open for an email from the Society of Nuclear Medicine in order to take the test and get the one voice credit. So with that, Cliff, I'll turn it back over to you.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.